All right. So we're going to keep on going. Our next talk, we're going to move into sort of more of a career development and that kind of section of our conference. Next talk is going to be from Dr. Anna Waterbrook. She's a professor of emergency and sports medicine at the University of Arizona. She completed her emergency medicine residency at Maine Medical Center and her sports medicine fellowship at the University of Arizona. She's a former associate program director of Arizona's South Campus EM Residency and Sports Medicine Fellowship and recently served on AMSSM's board of directors. She currently works as the team physician for the University of Arizona Intercollegiate Athletics. Current research interests focus on musculoskeletal and sports medicine education for residents, as well as sports ultrasound and other advanced sports medicine procedures. Welcome, Anna.
Hello. Can you guys hear me okay?
Mm-hmm.
Okay. I'm gonna see if I can share my screen here. All right. Can everybody see my PowerPoint talk?
Yep, looks good.
Yeah. Okay. Cool. All right. Well, good morning, everybody. Thanks for the great introduction, Ben. And it's really an honor to be here. And I think that's super cool that Ben and Ben have put this whole talk together. So thanks for having me. And I've been in the training room this morning, but listening into the prior talks, and they've all been amazing. But I'm going to, like Ben said, we're going to switch gears a little bit. And they asked me to talk a little bit about how to become an emergency sports medicine physician, keys to success for residency, applications, fellowship, and beyond. And we'll kind of touch on all of these topics a little bit, as I know there's kind of a mix of training levels and attendings in the audience. So presentation overview are some of the key topics that we're going to discuss. We're going to define the role and responsibilities of an emergency sports medicine physician. What do we actually do, and what does a career in emergency sports medicine actually entail? Talk a bit about the steps to prepare for residency, fellowship, and beyond. Highlight some strategies for residency and fellowship applications, and also look at what explore some future career opportunities and long-term success strategies. This is honestly a really cool time to be, I think, part of the sports medicine community. I know some of the other speakers kind of touched on the fact that we used to be a really small group. Sort of when I started doing this 20 years ago, there was kind of 5 of us in the room. And it was the same 5 people, whether we were at the sports medicine interest group at the ASET meeting or the EM interest group at the AMSSM conference. And now, we've got over 100 participants. We fill the rooms. We're definitely growing as a subspecialty, which I think is really cool to see. And it's not just emergency medicine, sports medicine, but sports medicine as a specialty as a whole. So there was a recent data released by the AAMC, and sports medicine is actually the fastest growing physician specialty. Since 2016, we've actually grown by 42.5%. We used to be surpassed by surgical or orthopedic sports medicine, but they have actually moved down to number 5. And I think that this growth is multifactorial, but a lot of it is, at least in part, due to sort of the growing demand with increased sports participation, increased athlete health awareness. And according to a couple of sports medicine market polls, the sports medicine market is projected to reach $12 billion by 2027. So probably all going to healthcare executives, but that is a totally different talk. So when you're pursuing a sports medicine fellowship, keep in mind, I know that this is an emergency medicine, sports medicine conference, but you can do this from several different primary specialties. So you can be family medicine, you can do internal medicine, you can do pediatrics, you can do PM&R, you can also do emergency medicine. And historically, family medicine doctors made up the vast majority of sports medicine physicians. And while they still do, like we touched on, emergency medicine is increasing their numbers substantially. And I think not just our numbers, but also our roles and some of our leadership roles within the sports medicine community are people are becoming more aware of our unique skill set. And we've really been able to become leaders in the field. I know Corey mentioned this a little bit earlier, but I think some of our skill sets are being recognized, for example, in the NHL and the NFL, where you're required to have an airway doctor. And certainly, I'm sure, the super public stories, such as like the life-threatening injury from Damar Hamlin, I think have reinforced the importance of our emergency medicine skill set in the sports medicine arena. All right. So, what is an emergency medicine sports medicine physician? And broadly speaking, it's basically what we're doing is we're combining our acute care skill sets of emergency medicine with our sports medicine expertise. And I think when a lot of people think about sports medicine, they think primarily of musculoskeletal injuries. But really, sports medicine encompasses way more than just musculoskeletal conditions. We certainly care for acute sports injuries. We provide sideline and event coverage, but also manage chronic conditions and really provide long-term care for our athletes, including mental health, nutrition, injury prevention. So for example, we may be on the sidelines managing a cardiac arrest one day, but in the training room, we might be seeing athletes with iron deficiency anemia and helping them manage that. So, and we can really do this in multiple settings. So some of us work primarily in emergency departments, some of us work in sports medicine clinics, some of us are team docs and work in athletic training rooms, as well as on the sidelines of sports. And Dr. AJ Monsu actually published an article in 2023 that kind of looked at the training and practice settings of various emergency medicine physicians. And he sent out 193 surveys and got 124 responses from dual board certified emergency medicine sports physicians. And he was looking at both jobs that emergency medicine physicians had post fellowship within their first year, but also how they're currently practicing. And over 50% of respondents actually are practicing both emergency medicine and sports medicine. About a quarter are practicing only emergency medicine, and then another quarter are practicing only sports medicine. The other thing that came out is, in addition to the variability in practice, really the overwhelming majority, like over 75% of these physicians said that they were happy with their career choices and felt fulfilled. So as we're growing, so have our leadership roles nationally. And I just wanted to highlight some of those. And this is not to be exclusive, but I just wanted to highlight some cool things that some of our members are doing. Don't feel bad if I left you out. I realized as I was putting this slide together, I could do a whole talk on all the cool things that emergency sports medicine physicians are doing. But on the left is Dr. Leroy Sims. He's actually currently the director of player performance for the Lakers, and he was the former senior VP and head of medical operations for the NBA. The next picture is Dr. Liz Della Sobera, who's going to be talking with us later. She's the head team physician for the Washington Capitals. Then you've got Dr. Jim Ellis. He's the emergency preparedness consultant for the NFL. And then on the far right is Dr. Chris Hogreff, who was recently named the head team internist for the Chicago Cubs. Certainly, there's a lot of us involved in collegiate sports, working as head team docs or team physicians, working in academics as fellowship and residency leadership. Others of us are working with Team USA and in the Olympics, but just kind of wanted to highlight the all of the cool things that we're doing. So why choose emergency sports medicine? So clearly, I've already highlighted some of the cool things that we're doing, but I think it's also really cool because it provides a ton of flexibility in your career. From an emergency medicine career standpoint, not all of the fellowships in our field allow us to practice different specialties in medicine, but sports medicine is one of the careers in which you really can practice a whole different field of medicine. And so there's just a ton of flexibility in how you practice, and that can change over a career. So you might start off primarily in an emergency department and transition to working primary sports medicine. You may do 50-50, you may do one a little bit more than the other, but there's lots of different ways that you can practice medicine to suit your needs. And you can also change the environment in which you practice in, like I talked about earlier. You can work in emergency departments, clinics, on the sidelines, and kind of blend those to suit your needs. And it makes us, I think, a lot more adaptable. As we all know, the healthcare landscape changes very quickly, and so it gives us just affords us a lot of career opportunities and kind of prevent against burnout. And I think, this also leads into what our opportunities are, because we can kind of blend the acute care that we have in the emergency department with some more long-term care of our athletes. And because sports medicine is really a multi-specialty career, it gives us even more opportunities to collaborate with diverse teams and really create teamwork with our colleagues in multiple specialties. All right. So EM residency application tips. So obviously, first of all, you got to get into medical school, but I think all of us here have jumped through that hoop. If you are one of the medical students listening in, the first step in doing emergency sports medicine is obviously becoming an emergency medicine physician. And, EM is still a very competitive field. So some basic tips are making sure that you do well on your USMLE or your COMLEX exams. And then while you're in medical school, as you know, there's some things that are just required, but if you can prioritize rotations in emergency medicine, trauma surgery, orthopedics, kind of demonstrates your interests and your skill set. Getting strong letters of recommendation are going to be important, and certainly participating in any sideline event coverage or community projects or research projects that you're interested in. And I think that this is important not to just showcase your interest when you're applying, but also to make sure that this is the field that you're really truly interested in and suits your needs. I think it's important to choose your specialty and subspecialty, not by sort of like all the cool stuff that we do, because I think a lot of us like the cool parts of most subspecialties, but also think about sort of the mundane stuff, like, in the emergency department, drunk, belligerent patients, stinky feet. In sports medicine, we definitely get some chronic pain patients. So think about that also when you're choosing next steps in your career. So once you're in emergency residency, residents, interns will often ask me what they can do to get themselves set up for sports medicine. And I think rule number one, while it's important to always think what your next step is going to be, make sure your number one step is to be a good emergency medicine doctor. So make sure that you are learning the bread and butter of emergency medicine and how to do that well. That being said, you can also develop your area of interest or your niche in sports medicine. So look for opportunities that offer some hands-on experience, whether that's working with sports teams or event coverage. Network with colleagues, try to find mentors. Not all places have emergency sports medicine mentors, but you can also look in other specialties to see if you can find a sports medicine mentor. And if there really is nobody locally at your shop, you can also, as you're seeing, there's a lot of us nationally that you can reach out to start to network and make connections. All residencies require an academic project, so you can align your academic project or your research with your interest in sports medicine. You can focus on, musculoskeletal exam proficiency. And also, if you can, I know your time is limited in residency, but if you can get to an AMSSM conference or an ACEP conference and join the sports medicine interest group, that will also allow you to get more experience in network. So pathway to sports medicine fellowship, there are more and more opportunities for emergency medicine physicians, and actually the total number of sports medicine applicants has increased substantially over time. And that's not really a surprise when we see how fast sports medicine is rising. Luckily, the number of sports medicine fellowships has risen commensurate with the increase in the total number of applicants. That being said, it's still pretty competitive, and there's approximately a 70% match rate in the match. We tried to break it down a couple of years ago based upon primary specialty, looking at EM specific, but unfortunately that data is just not available to us for fairly complicated reasons that would take me too much time to explain right now. I'm happy to talk offline. Um, there aren't, so it is a little bit more competitive for emergency medicine though, because not all programs take emergency medicine applicants. And because it's a one-year fellowship, this can actually change over time. So it's important to start looking early if you're interested in sports medicine fellowships, start researching fellowships, looking for places that take EM trainees, places that have EM sports medicine physicians already on faculty can be really important. Um, Things that we already discussed in terms of building some of your foundational skills in residency as well. And then the other thing I wanted to mention is that, when you are writing your personal statement, really, focus on your unique skill set, your leadership roles, et cetera, when you're applying. Jason Zaremski did a study in 2021 where he surveyed program directors in sports medicine to see what they were looking for in their applicants. And the three things that came out as being the most important to program directors is number one, how you do on your interviews. So make sure, you show up with your best foot forward, you're not late, and that you've researched the programs that you're interviewing at. Strong letters of recommendations from sports medicine doctors. So if you don't have an EM sports medicine doc in your group, making sure that you're getting rotations or getting some face time with sports medicine doctors, and then experience as a team physician at any level. So, that could be going to the sidelines of a high school team, shadowing somebody on the college sideline. That looks many different. It's not a one size fits all, and it can look different ways. So key fellowship experiences once you get to fellowship, certainly you'll do core rotations like orthopedics and sports medicine. You'll be involved in a variety of event coverage and working in the athletic training room. And then you will also acquire lots of different skills, including things like musculoskeletal ultrasound, advanced procedures in regenerative medicine and others. And not every program is the same. So you want to think about what you like to do and think about what the individual programs, what their strengths are, and what you want to be exposed to when you're choosing your fellowship. Career pathways post fellowship. A lot of this we've sort of talked about, but one of the things that I really love about sports medicine is the flexibility that it gives you and the teams that you're able to make as you progress throughout your career. Like we talked about, you can kind of define your career based upon the percentage of sports medicine versus emergency medicine, as well as your practice setting. So you can do academics, you can do private practice, you can work with pro teams or college teams. It's certainly a little bit easier to do emergency sports medicine and combine the two practices if you're in an academic setting. That being said, it's still totally possible to do it in a private practice setting. I've seen our colleagues start off, for example, starting in an emergency medicine group and sort of working the minimum number of shifts to be full-time while also doing a clinic day a week in a sports medicine practice. And then I've also seen the converse where people have worked primarily in sports medicine full-time in a clinical setting, but will moonlight in the emergency department occasionally on the weekends or during their off time. So, like I said, there's lots of different ways to do this. But think about, and even within sports medicine, emergency medicine, you can create your own niche based upon what your interests are, whether that's, academics or GME, musculoskeletal ultrasound, concussions. But you can really kind of create your own niche within this field. Think about what you would like to do outside of work and try to find a way to bring that into your clinical practice. Challenges and opportunities. I mean, certainly in any field, there's going to be some challenges. And some of the challenges I found in emergency sports medicine is sort of finding that work-life balance or work-life integration, where you're kind of trying to combine multiple different different things that you're doing, and not everybody knows necessarily what you're doing on what seems like your off time, but you're like, okay, well, I'm not in the emergency department today, but that's because I'm in the training room, or vice versa. They want you to cover some events, and you're like, well, I've got an ED shift. And so, you can be pulled in a lot of different directions, wearing lots of different hats, and you can get very busy very fast. So it's just important to really communicate and figure out what it is that you really like to do. And if you're looking for a team physician slot, that can be really competitive for those team doc roles. So, it's always best to be as prepared as possible when those roles do come up. So, make sure that you're taking advantage of opportunities, and sometimes even starting with other roles, such as working with a high school team, doing telemedicine, taking opportunities to give talks so that you are prepared when those opportunities do come around. So keys to long-term success. I think some of this is pretty obvious, but I thought it was important to mention. Number one, I mean, you want to work hard. I think we all work hard, but it's important to continue to do throughout your career. Always be excellent. Make sure that you're kind of staying on top of the cutting edge information, and that you really hone your skill set, and that you're really good at what you do. Really important to be a team player. I think all of medicine is really a team sport, but I think it really comes true in sports medicine, where there's lots of different components to the team, and each plays their role, and it's really important. I think a lot of people get caught up in a little bit of hubris with sports medicine, and you always kind of got to keep your ego in check, and be a part of the team. And then ultimately, my advice is to just always be a good human and treat other people the way that you would like to be treated. So that's it. I know I'm running a couple minutes over time, but just to kind of recap, emergency sports medicine is an up and coming field, and there's lots of opportunities. It's honestly been so fun and rewarding to see it grow throughout my short time being a part of the community. When you're in medical school and residency, it's really important to really build on your foundational skills. As you're applying to fellowships, you want to really strategically approach your fellowship, and really put some time and effort into your application process. I cannot overemphasize the importance of developing strong mentorship and professional relationships, because, like I said, it's all about teamwork. And remember that you're going to continue to grow post-fellowship. Remember that we call this the practice of medicine. There's always going to be new things that come up that you don't know how to do. So be humble, ask for help. There's always opportunities to learn more and do more. You really want to become lifelong learners. And I think that's all I've got. Thanks for your time.
Thank you, Dr. Waterbrook. We actually have a question in the chat. Um, it says, for the residents at programs who do not have a sports medicine fellowship in-house, what can we do to improve our likelihood of matching for fellowship?
So I think that kind of goes back to some of the things that I was talking about earlier. I think number one is mentorship, finding other EM sports medicine docs or other local physicians that are sports medicine doctors, even if they're outside of the emergency department. But if you don't have any of those, looking to some of our national societies, so reaching out to the EM interest group members of AMSSM, or looking at the sports medicine interest group of ASEP. I mean, full disclosure, most of us are in both of them, so you're going to kind of be looking at reaching out to the same community. I know somebody mentioned the fellowship match website with ASEP, that it sounds like that's being updated, that Dr. Jeff Fedden created many years ago, but there's contacts through all of those societies. So I think really finding your mentors and finding your team. And then, like I talked about, the things that fellowship directors are really looking for is doing well on your interviews, doing a sports medicine rotation, getting good letters of recommendation, and having some experience with sideline and event coverage.
And then one more question, Dr. Waterbrook, for the recent graduates, maybe they're attending now, they've came to sports medicine late. Any advice for them getting back into a sports medicine fellowship?
So meaning that they've already been practicing physicians?
Yes.
Yeah, I mean, to be totally honest, it is definitely a little bit more challenging to be able to do that, because once you're an attending, you don't necessarily have all of the opportunities to to do rotations and volunteer. That being said, I think the best thing that you can do is find volunteer opportunities. So you might be able to help with local events such as marathons, other sort of triathlons, other endurance events. Make some connections with if there's like a local residency or fellowship program to see if there's any volunteer work that you can do. Unfortunately, you can't usually do rotations if you're not an enrolled student, but I think making connections with folks locally and seeing how you can get involved with some volunteer work would be the best way to kind of get your foot in the door there.
Thank you so much. It looks like Dr. Hudson will be discussing this more at 3 p.m. as well. Thank you so much for your time.